subscribe to our YouTube channel and press the bell icon to get the latest updates.
Hello and welcome to the World Economic Forum here in Geneva, Switzerland. And we're live and joined by more than 120 journalists from around Africa and by World Health Organization officials in 3 countries. You can follow this conference live on WHO Africa and WEF social media. Delighted to be joined in Congo, Brazzaville by Dr. Michel Yao and 2 of his colleagues who'll be with us very shortly, Dr. Zabalon Yoti and Dr. Matshidiso Moeti. In Senegal, delighted to be joined by Dr. Lucille Mbua. And in South Africa, we have with us Dr. Owen Kalua. We've received very, very many questions from all of you up front, and we'll turn to each of our panelists to get their views on this. And I can see in in Congo, Brazzaville, that we are now joined by Dr. Moeti and by Dr. Yoti, which is fantastic news. They're just settling themselves into position for the call. The first question, top of the list from everyone calling in: why is it that the spread has been apparently slower or later in Africa? And I'm going to turn first to Dr. Moeti just to answer that. Why has the spread been apparently slower or later in Africa? And Dr. Moeti, welcome.
I think that, we don't have an explanation of why we haven't started seeing cases from the African region up to relatively recently and increasing very fast in the last 10 days or so, I would say. So for the last couple of months, 3 months since this outbreak started, we have noted, as we have seen cases in first Asian countries, then European countries, that there have been relatively few countries that were affected in Africa. But we noted equally that there were relatively few countries affected in South America as well. So our initial thinking, we were wondering, and I'm not saying that this is our view, whether it was related to influenza seasons, because this is a coronavirus like the influenza virus, and that we would expect to see an increase in the future, in the near future. We also were very concerned, of course, about the contact between China as a key economic partner of African countries and African countries all over the continent, and assumed and were concerned that the first cases would come from there. So with some hindsight, perhaps what has happened is the types of measures that the Chinese government put in place relatively early in their own outbreak to prevent the spread within China, of course, and they took an approach that also very much addressed the potential spread outside of China. They started some interventions for international travelers leaving the country, going elsewhere. People were put into quarantine for 14 days, so that risk was reduced. And it is, as we have seen the virus spread across other regions, principally Europe, which our Director General has described now as the epicenter of the outbreak, and with a close travel between European and African countries, that we've started seeing travelers from European countries arriving in Africa with infection. And that is the case now in about 28, 27 countries. And then in 4 other countries in the African region, we have seen community spread, local spread, also principally with the virus initially brought in by either African people or travelers from other regions who were traveling from European countries. Our main concern, of course, is to, now that we've seen a quite rapid increase geographically of the spread of this virus across countries. About 10 days ago, we had about 5 countries affected. Now we've got 30 almost. So it's been an extremely rapid process, rapid evolution, and our main interest is to help the countries to contain this and to delay or prevent local or community spread of the virus.
Thank you very much, Dr. Moeti. And perhaps we can just get a brief sense from your colleagues in Senegal and in South Africa of their perception of how the virus has developed in both of their specific regions. Dr. Mbua, can we just turn to you briefly?
Okay, good morning. In Senegal, as we see in the other African countries, we have now 36 cumulative cases confirmed, with 20 cases with a local transmission. At the beginning, we have imported cases, but in one setting, we have local transmission. And we can see that the way of people's lives here in Africa could push the population to contract the virus, because there is a lot of people in the same house, and we can see that it's a factor for local transmission.
Dr. Kalua in South Africa, can we just turn to you and say how speedily has your country represented been affected by this virus?
Thank you very much. The first case was confirmed in South Africa on the 5th of March. And by the 18th of March, which was yesterday, we had 116 cases that are confirmed. At the beginning, until around the 15th of March, all the cases that we had were cases that were imported. And mostly for people who had, South Africans who had returned from travel in Europe. But by the 15th of March, we reported the first cases, confirmed first cases for local transmission. And as of yesterday, we have 12 such cases that are confirmed to be of local transmission. So within a period of 13 days, we have grown from 1 to 16 to 116 cases with 12 cases of local transmission. And most of these cases are in Gauteng, and that's the province where we have Pretoria and Johannesburg, and also in KwaZulu-Natal, and that's where we have Durban, and in Cape Town. In Western Cape, which is where we have Cape Town. So the three hardest hit provinces are those three that I've mentioned. Thank you.
Thank you. Another of the top questions that we have from journalists around the continent is, given the relative capacity for testing and treatment, along with the crowded living conditions and transportation conditions in Africa's cities, can we expect, what can we expect of health systems and social structures given the onset of this virus? And Dr. Moeti, I'll go back to you in Brazzaville, Congo, and perhaps if you want to bring in your colleagues there as well, just to give us a perspective on that.
Yes, I think these are two aspects of the realities or of the context in many African countries that are of greatest concern to us. First of all, as regards test kits and the global challenge in the availability of the quantities that countries would like to have of test kits, we would like to encourage, and our Director General said so very clearly a couple of days ago, a very, how can I say, a very focused screening and case finding strategy, whereby people who have suggestive symptoms and those who might be contacts would be tested. This would enable countries to know as early as possible where infected people are and initiate then those interventions around social distancing, self-isolation, and the hygiene measures that are so very important for preventing onward transmission. But there is a challenge of availability of test kits. We are aware that there are some manufacturers in a number of countries that are developing new test kits, and we are very keen to work with our colleagues in WHO to proactively explore those possibilities of test kits, particularly testing approaches that would be carried out in a minimally demanding way, as broadly and widely as possible, so that countries can be able to tell very early on when people are infected early in their infection when they start to show symptoms. This continues to be an area of challenge in which we are working with our colleagues in WHO headquarters. What we have been very encouraged about, though, is the progress that countries have made in putting in place their capacity to diagnose this virus. Because at the beginning of February, for example, we had only 2 laboratories in South Africa and in Senegal that were capable of diagnosing this virus. Now we have 40 countries that have the capacity, admittedly in the central hospital in the capital city, but at least the need for moving specimens around between countries is very much minimalized now. So that is one area that requires, we think, really intensive work, international collaboration, perhaps public-private partnership to explore to the extent possible. And then the second question, it is true that, if you like, the socioeconomic circumstances of many African people, particularly in urban areas, make social distancing the way it is being recommended quite a challenge. Sometimes families live in houses where you don't have a bedroom for every family member. Quite a few people in the family have to sit in the same space, sleep in the same space sometimes, and the facilities are not in place. In addition, it may be in houses that actually do not have running water. So the possibilities of hand washing in the way that it's recommended, frequently hand washing with soap in certain ways, is a challenge under those circumstances. We are recommending approaches that are adaptable to these circumstances. So, for example, working with partners and with governments to make sanitizers available to people in health facilities as well as in families. We need to think about what it means to do social distancing at family circumstances where people live in crowded conditions. And we are thinking we might have to think differently about the use of masks. These are issues that we are considering within our team. We will need to adapt to the extent possible to these contexts, the principles of not infecting each other, either from droplets when people cough or sneeze, and also from hands, so keeping hands clean, and very much communicating with people about these measures that they need to take. So we're very aware of the challenges presented by these and are looking for ways to innovate around them. I think that using sanitizers, getting the word out to people, making sure that we consider and have access to masks where they may be used in slightly different ways in the settings where this is a challenge. These are some of the advice that we are giving to governments and to communities.
Dr. Moeti, thank you. And lastly, another question that came in from a large number of the journalists in today's call is relating to something you touched on at the very beginning, which is the climate and the seasonality. There's been some discussion, some speculation that heat and humidity can act in some way to slow the spread of the virus. Is that something you or your colleagues have experience of or any observations on? Or is that something that's not factored into your approach to this crisis at the moment?
No, this is something that we are studying at the moment. So we are looking with our team and some academics in some institutions at what have been the patterns, for example, of influenza in our region, and what then we may infer. And here I have to emphasize that these viruses are different. This is a new virus whose behavior we are still trying to understand. But we have noted, as I said, that similarly to African countries, in Southern American countries as well, there has been spread, but it has not been the same as we have seen in the global north. So we are trying to understand if this could be related to temperature, to weather. Certainly, we know in the past from influenza data that we have a distinct flu season, particularly in the southern part of the continent and in some Eastern African countries. So we may, from this, infer that we should expect, perhaps in a couple of months when the winter sets in the south, to see an increase in the rate of transmission of this virus. We are looking at this, looking at data in the past, looking at seasonal patterns, and trying to anticipate, in a sense, what we might expect. we don't have this information for this particular virus because it is a new virus, which has largely been spreading in the north, and now we need to understand and anticipate how it might behave in African settings.
Thank you very much. We have a question from the Portuguese news agency Lusa, from Cristina Fernandez Ferreira, and I'm just going to check and see if we have Cristina on the line here to pose her question. And we don't have Cristina in voice form, but we do have her question here. So on her behalf, she's asking, as hand washing with water and soap is one of the principal recommendations to avoid transmission, how does the World Health Organization estimate this measure will be carried out in Africa, given there are wide areas with poor access to water and drinking water?
Perhaps I'll turn it over to one of my colleagues to respond to this question. Michelle.
Thanks.
Yeah, thank you. It is indeed one of the challenges, mainly in rural areas where access to this item, mainly soap and water, could be an issue. And we have also to think about many displaced population due to security challenges or any other humanitarian crisis. So it's why it's actually necessary to work with different partners, mainly NGO partners, like what we did in the past for some of the outbreak, like cholera, where these NGOs were involved in ensuring access to some of the this basic need, mainly water as well as sanitation, distributing soap and so on. So this is should be, and I'm sure it is already done in many places, part of the preparedness and readiness strategy of countries or NGO partners prepositioning this item and thinking about means to make them available. Compared to the alcoholic solution, in many places, soap at least can be accessible, and it's one of the things that we should work on.
So if I may add, there is a very interesting initiative by a woman called Miriam, who is a hand-washing activist, I would say, who works for one of the soap manufacturing companies, who is mobilizing at the global level a group of private sector partners to come together and work on seeing how to make soap available very widely to contribute to this response in African countries. They are aiming to start this in Kenya. They had a meeting the other day. So at least if we have that item provided by partners free of charge in health facilities and in homes for the community, and then work with our partners around the availability of water, this is something that can happen to then supplement the use of these alcohol-based sanitizers.
Thank you. We have over 220 journalists on the call at the moment. And just want to say you can use the chat function on this call. We have someone reading that for us at the moment and going through. So if you can tell us your name and your news organization and your question, we can put it to our guests from the World Health Organization. And just one question that I have got just come in is Africa is obviously deeply experienced in malaria. And a question from Nigeria, from Madupe Adeloju, says there are claims chloroquine can cure the virus. How true is this? And does that have specific relevance to the African situation, given the prevalence of malaria and given the availability of chloroquine? Dr. Moeti.
Well, we are aware of some trials of the use of chloroquine in dealing with previous coronaviruses, not this virus. We're not aware of any evidence that demonstrates that this is one of the medicines that could be used, but we can find out more information about that. There is a number of trials of other medicines currently ongoing, and we are waiting the outcome of those observations of whether some medicines could be effective in treating the virus. But at the moment, we are not aware of any conclusive evidence to show that chloroquine could be effective in treating this virus.
Then we have a question from South Africa. I'm going to go to Dr. Kalua first on that. Do you believe, this is from Nabila Sheikh from ETV News in South Africa, and she asks, does the WHO believe that South Africa should be placed on lockdown considering the rising number of COVID-19 infections, and should any support be offered to the country regarding informal settlements and townships? Dr. Kalua, any response to that question?
Thank you very much. On the 15th of March, the President of South Africa declared a national disaster as regarding to COVID-19. And with that, there are a number of measures that were put in place that the country is going to follow in order to aggressively address the issue of COVID-19 in terms of containment, and where possible and indicated to start to do mitigation measures. But as to the question of lockdown, I suppose this, as in the first decision of the measures, is a national decision, and as and when the national authorities see fit that they need to implement these measures, then they will probably do so. But at the moment, that's not where the country is. There's just heightened response across all sectors of government in trying to address the question of COVID-19. Now, the issue of informal settlement is quite critical, and is also a thing being discussed here in country, that if we do get the COVID-19 into the informal settlements, it may become a bit more difficult to deal with. So some of the efforts are trying to see what can we do to limit to the more suburban areas where the problem is at the moment. But of course, the issues of hand washing, we have discussed, the issues of social distancing will become issues if we get the virus gets into informal settlements. And what we need to begin to think about is what are some of the innovative ways that we can apply to be able to do so, to be able to implement these measures in the crowded situations as obtains in the informal settlements.
Thank you. And we have a question, just to follow up for you, Dr. Kalua, from Janice Q at Bloomberg, who asks, how concerned are you about the number of test kits available to test for the virus in South Africa? And perhaps some of your colleagues in other places can answer that too.
Thank you. On the number of test kits in the country, as you know, this is a global problem in terms of shortage of test kits. But the government is working on that, and we've been working with them also to strengthen the capacity of testing. But what has happened is that the government has reached out to the private sector and has worked with laboratories in the private sector, which are also beginning to offer these tests. Beyond that, at first, the test was just being offered at the National Institute of Communicable Diseases in Johannesburg, and that institute has helped to build capacity on a number of laboratories in the provinces, so that they too can begin to offer the test in terms of building the capacity. So the collaboration with the private sector and engaging them has been one of the mechanisms that have been put in place to increase the access to testing, so that we can detect as many cases as possible and put in the necessary measures to contain the outbreak. Thank you.
Thank you. Dr. Moeti, to move back to you, a question from Ed Cropley from Reuters, who's asking where are Africa's governments going to find the money to pay for their antiviral responses, given the huge obligations they have already?
Okay, there's been, I can say, a very strong response at the international level of contributions and commitments of financing to respond to the COVID-19 outbreak generally. And several donors have specifically indicated that they are very interested in supporting low resource settings, settings with weak health systems, and specifically African countries. So we have had, first of all, the World Bank has pledged up to, or has decided to make available up to $12 billion for the response to the outbreak through several means, including for national responses, through some of the mechanisms of cooperation and financing between the World Bank and countries. This would require that the governments make a decision to benefit from this facility and indicate an interest through their ministries of finance and make a request through the World Bank country directors' offices in countries for this money. In addition to that, the African Development Bank is looking at making some resources available. And then we have had the European Union, other Western countries, other countries as well, some from the Middle East, through a mechanism that WHO has established of putting in place a platform whereby countries develop their national plans for preparedness and response. WHO and other UN entities and partners then look together how to support these plans. So there is a facility for supporting national plans, supporting also partners' plans in the action that we and other UN agencies and other non-governmental organizations, technical agencies are going to take to provide technical support to the countries for the work that they have to do. So I can say that there is a global platform into which entities with the resources can provide some funding for some of the work that is to be done. And some of this is also going to be offered by some of the private foundations, non-governmental organizations, and charities that support development and health. So there has been,
that's great.
I would say, a very positive response. Now we have to see if the funding will have to be enough. We are, of course, advocating with the governments themselves to provide some domestic financing for some of this work and invest in improving their health systems at the same time.
Thank you so much, Dr. Moeti, and thanks for those answers. We've got a lot of questions coming in here, and I know we've got on the line from Business Day in South Africa, Tamar Khan. Tamar, you have a question. See if we can get your audio up.
Hi there. My question was about test kits for Africa. Do you have a forecast for the number of test kits that are, or the anticipated demand? And what measures, if any, are in place to improve access and bring down the costs of these tests? I'm wondering whether there's any work going on in the way that the cost of ARVs was brought down very effectively. Is any similar work going on around testing and test kits? Thanks.
Thank you.
Yeah. About testing, it will also evolve with ongoing outbreak and increasing numbers. For example, we try to supply countries with a basic of 2,500 kits. That is roughly about 200,000 for at least the 47 countries that our office is covering. So this is roughly to start with, and it's what they are using now. And most of them are actually requesting replenishment just a month after. So this can roughly give an idea, but this kind of need can easily increase when we have also increasing number of cases and where you may need at least to test some of the contact becoming symptomatic.
So just to add, we're working on some of these projections, and as you can imagine, this is quite a challenge because the situation is changing so quickly in terms of the numbers of countries that have cases. We have, of course, pre-positioned supplies, as my colleague said, in all the countries to make sure that they can, when they encounter a situation where they need to start testing, they can do so. So we are working to see what is the utilization rate, make some estimates of how this will expand as we see expanding numbers of cases. And as I said at the beginning, are also encouraging a very proactive case finding strategy that will demand even more test kits. So this is something that is a work in progress with our colleagues at the global level, really to see if we're going to support countries to contain the situation, to be more assertive in case finding, what sort of quantities will be required and what work then will need to be done to make sure that these are being produced, are being procured, and are being shipped and available to countries.
Thank you. And a couple of questions on the same theme. One from Jude Egbass, who's a senior editor at Pulse Nigeria. And on a similar thread, Elizabeth Merab from the East African newspaper in Kenya. Yesterday, the Director General in his press briefing said the cases being reported in Africa may be lower as more cases may be slipping through the cracks. What's your best estimate currently of Africa's infection numbers?
Yeah, I think it's quite difficult to make an estimate of infection numbers because this infection can be asymptomatic. And that is the case all over the world. I think it's very difficult to estimate the numbers of people that are infected. We actually don't believe that there are large numbers of African people who are undetected and infected because this is an infection that has come in over the last 3 months. Initially, we were worried there might be people who are not infected. We have not seen people manifesting this illness in countries, or we have not seen clusters of cases that might be suggestive of what had been previously undiagnosed infection that is now resulting in serious illness. We have not seen that. So our sense is that this is a virus that is coming into countries through travelers from places where the infection is circulating. It may be that after a case has been in an aeroplane or in a locality, there may be some people who have been infected who may not have been detected. We have systems in place where countries are working very hard to identify the contacts of a case that has come in and to follow them up and to see if they then develop into cases, sometimes quarantining them, sometimes testing them. So although there may be some undetected infections, we do not think that these are very large in number.
And we can go to Kenya and Elizabeth Merab from the East African newspaper is there. Elizabeth, follow-up question from you. You had a number of questions, I think, but we've got time for one of them to our panelists.
Thank you so much for the opportunity. The other question I had was that, about the testing kits, it has been answered. But then there was the issue about the robustness for East African countries to test and to report the cases, given that South Sudan, if I'm not wrong, and Burundi and Uganda yet have not reported any confirmed cases. Is it that they are none, or is it that they are just not yet reported?
Great question. Dr. Moeti or one of your colleagues?
Yes.
Thank you for that question, although we really didn't get it clearly. But I think you are asking that some countries in Africa, like Uganda, Burundi, and so on, have not reported cases. And you think that maybe they are missing cases. Are the systems robust enough? That's what I've understood. Indeed, there are countries which have not reported cases. But what we have seen is they are applying the full measure of trying to find that case. They have actually what we are calling alerts. It means people who present with things which are similar to this coronavirus. They investigate, and in some cases they have gone up to testing, and all in these countries have so far tested negative. And also they have measures like trying to limit the movement of those they think are at high risk. Quarantine measures they are put in place. So the systems are there, and it is the same systems which have picked cases in the countries which are reporting. So we do really believe that if the cases were there, they would be picked. Thank you.
Thank you very much. And we've got some questions too coming in about public health messaging across Africa, where we've seen instances where it's incredibly difficult to get strong public health messages out. We have questions here asking if ibuprofen is usable in treating it, if alcohol wards off harm to people who are infected. These all speak to probably a big gap in people's knowledge about how to respond to this. So, Dr. Moeti and perhaps your colleagues, is there a strategy the WHO has in place to put out good information on this? I know this call is part of that process, but is there a wider strategy to help inform the people who are going to be affected by this virus about the kind of measures that are effective?
Yes, indeed. There is a risk communication, as we are calling it, and community information strategy that is in place, working with governments and some of our partners. We are going to be working very strongly with UNICEF on this in the future, is what we are just agreeing, of putting out the correct information in several ways, through, if you like, the public media, the radio, television in countries, and very much working through community groups, working at the community level, through churches, church groups, through associations of people. And so this is something that we are aware needs to be addressed very strongly, because we are aware that there are many false beliefs, there is incorrect information circulating around. And then as well, through the social media. You know, young African people are very connected through the social media, and we're making them aware that at the global level in WHO, we have access to information which is correct, giving the right facts about these problems. And we have an arrangement on the WHO website where people who are interested in information about the coronavirus are led to correct information if they are going on Facebook or other platforms, so that they get the right information. We are very aware of the importance of counteracting incorrect information, and certainly information that will put people at risk if they believe they are falsely safe. We're very much putting out the simple information about the measures to take, simple hygiene, social distancing, and reporting what types of symptoms to a health facility people get them.
Thank you for that. We have a question from Thomas Muller on a slightly more positive note. We've talked about some of the disadvantages and challenges facing African health systems. Thomas Muller from Bloomberg is asking, Africa has a relatively young population. Does that count in its favor? And it also has a great deal of experience in dealing with communicable disease, even in conditions where there's a big lack of resources. Do these things speak in its favor? Dr. Moeti.
They do to some extent, although we also need to be evidence-based with regard to the demographic and be aware of some issues that may be at play in Africa, which are not in our region. I think certainly the in-depth experience that we've had with some very severe, widespread outbreaks in the African region is an advantage. It's an asset. For example, some of the work that we are doing has been based very much on the platforms that have been established in response to the Ebola outbreak and the preparedness that was in place for the Ebola outbreak that's just winding to a finish, we hope, in the Democratic Republic of the Congo. So the community platforms, the learnings from that experience, and the mechanisms that are in place are going to help us. And we do have a younger population than in many countries that are affected by this outbreak. We just need to be aware that among the young in Africa, in some settings, we have high rates of HIV prevalence. And in areas where we don't have universal access to treatment, there may then be people who are vulnerable because they're HIV infected and immune compromised. And equally, we have a very young population. We also have malnutrition, relatively highly prevalent compared to Asia or European countries. And this also may be a factor then that's making children or young people vulnerable to more severe forms of the illness than they have been seeing in other regions. But on the whole, I think our experience with outbreak is an asset. It's a positive for the African region.
Two questions from Francophone media. I have Joan Tilouin from Le Monde Africa Bureau. How do you work to avoid the mass spread of the virus in megacities like Lagos, Kinshasa, and Luanda? And also from the Voice of America's French service, Koi Gwahinga, how does the WHO ensure that focus on COVID-19 does not distract from other more lethal ongoing crises? And he mentions the measles and cholera outbreaks in countries like DRC? Perhaps we could also bring in.
Very much. In fact, what we are advising countries and we are helping them to have in place at this time is that in these cities, these sporadic cases should be strongly managed. Is to ensure that at least we have a comprehensive contact listing and follow-up, that any new cases coming from this contact can be quickly diagnosed and also isolated and receive appropriate treatment. One of the critical things that we are doing also in the big cities is also a proper risk communication and engaging communities to a wider community-based surveillance network that can help us to detect. It involves also all the community leaders and also all the NGOs around the table to deal with these issues. Other crises, actually, as I mentioned earlier, the assets in place for Ebola preparedness, as well as even the normal influenza program, help to deal and to kick off response in many places. And we are also working with countries to ensure that at least they have a mechanism to deal at the same time with all these ongoing. So the idea is to kind of provide this stronger response early, and to avoid that we have a bigger crisis that will disrupt totally the system and affect other disease. And time being is how can we manage both at this stage? How can we continue treating malaria, continue also dealing with safe burial services so that at least we should not have a kind of a side effect in terms of death toll related to other disease, while emphasizing to control corona. So this is a work in progress, and we are working closely with countries to have this process of screening, for example, in hospitals, so that you can have a channel to deal with corona while other patients will continue to receive treatment.
So, if I may add a word, perhaps also appeal to our colleagues and partners in the media to help with this, so that we continue to keep an eye on, talk about, provide information about these other health problems at the same time as providing information about the coronavirus. I've just noticed that when I turn on my television or the radio at the moment, it's virtually only news about the coronavirus and its various aspects. So it would be great if we also got some sending news out about the fact that we're counting down on the DRC's Ebola, the measles outbreak in there, and other cholera problems still need attention. So that would be really good to do together. When we have repurposed many of our staff from other programs to support this coronavirus response, but we have made sure that we keep intact the teams that have to work on the major outbreaks that are going on, and just sustain the support from WHO to the work that those governments are doing. Thank you.
If I may add also,
thank you. I just want to bring in Dr. Mbua from Senegal, if I may, just to get her perspective, perhaps. Dr. Mbua, I hope you can hear me. We have a question from German National Public Radio from Mark Engelhardt, who's asking, with the global north preoccupied currently, how concerned are you about the ability of West Africa to cope by itself without the traditional support it receives from donor countries?
Sorry, I didn't hear the question.
So the question is, how concerned are you without support from traditional donor countries of the facilities on the ground in West Africa to cope with this virus outbreak, as these countries that traditionally give help are coping with it in Europe and the US and around the world?
Okay, at this moment, US and other countries give help. And we support the government to identify their needs. And we just compiled the needs, and we met this morning with bilateral partners to help to support the needs that were expressed. And they have the willingness to continue their support. And we are here to coordinate all these supports through a platform, a regional and local platform of partners to address this fight.
I know we've allowed 45 minutes for this session. I think if we may, we've got so many questions, if we could just maybe take a few more. One question that's come up repeatedly from our questioning audience online is really about the number of ICU facilities, ICU beds, and staff who can help with those most severely affected in this crisis. What is the situation like across the continent for that kind of for those kinds of facilities, and where are the areas of concern, Dr. Moeti, and where are the areas where you think actually there are the facilities in place and there is the capacity?
Yes. Well, we are collecting information right now on the capacity for critical care in African countries. So the number of beds, number of specialists that know how to manage patients that need critical care, nurses, and so on. So it's not possible for me to give the numbers. What I can say is that we recognize that these are in very short supply in most of the countries in the African region. So if we take a country like South Africa, which has one of the most developed, I would say, health systems, both in the public and the private sectors in the region, they are recognizing too that looking at the evolution in terms of the number of cases, if the situation, I feel like, explodes in numbers and large numbers of people have severe disease and are critically ill, there will indeed be a challenge. And then the situation in most of the rest of the region is more challenging than that. So that we recognize is going to be an area that, and is an area that does require in very serious efforts and urgently needs some intervention. We have been able to identify the possibility of importing into countries, helping them to import what you might describe as a type of field hospital type of facility that can be brought into a country, set up, and then equipped with some of the key items that are required, including ventilators and sources of oxygen, so that the type of critical care that it will be needed for serious cases will be made available. This is truly one of the biggest challenges of the situation, but we are working very hard again with our colleagues at other levels of WHO, at the global level, and with governments to work on this estimation of needs, to at least expand some of the minimal capacity that is here, that is in place. We're also helping some of the countries to adapt existing facilities and have a facility that will take the first few cases while more expanded space is being availed. This is part of what the funding that's being made available by the international community, including by the World Bank, is going to be utilized for example. And then we are carrying out training. We have carried out some training here in Brazzaville, in Dakar, working with the Africa CDC. We're about to work with the Association of Physicians to carry out more training, so that they in turn can train healthcare workers in countries, at least have the technical expertise, the skills available, even as the materials needed are being brought into the countries.
We've seen, by the way, in countries around the world that healthcare workers and medical professionals are amongst the most severely affected by this. They get the most exposure almost of any single group. How concerned are you about the measures in place to protect them? That's a question from Brian Pearson, Africa Confidential.
Do you want to answer? I'll turn it over to Michelle Liao, one of my colleagues.
Thank you.
Yeah, of course, this is really one of our major concerns based on the situation in most of the African health facility settings, mainly when you move a bit out of the capital cities. Actually, protective equipment is a challenge, and the procurement is a bit difficult at this time as the huge demand coming from almost all the countries around the world. WHO is actually helping and facilitating procurement, and any support from in this area for countries that want to support African. We saw some of the foundation, even the private, trying to help countries is one of the areas where support is welcome, and is where also countries, inside countries, if there is a possibility for in-country procurement, I think national authorities should emphasize on. In Ebola, we saw also many health workers being affected, and it's one of the actually concerns that need to be addressed with all the different partners.
Probably time for just a couple of questions to conclude. One is, can African countries economically afford to put in place travel bans and restrictions to stem the spread of the disease? That question from Yinka Shakunbi in Nigeria. And also we have a question from a radio network that sends signal broadcasts out to sub-Saharan Africa, from David Mowbray, who says, will the WHO be providing message packages on the coronavirus? Dr. Moeti.
Yes. Yeah, so we are observing, of course, a raft of measures, including border closures by countries in our region as well as in other regions, while at the same time we are learning a lot about the economic impact at the global level, and also expecting to see then the economic impact of these barriers being placed in the way of goods and people and money moving between countries in trade and so forth. This is a big concern. We are encouraging countries to take measures that will isolate the virus, isolate perhaps the people who might have the virus, and really minimize, unless it's absolutely necessary, isolation of countries, while at the same time putting in place very strong measures of identifying those who are infected and contact tracing so that we limit the spread of the virus. So this is a concern. What we are deciding to do, because we are concerned as well about the impact of such measures on the ability to move some of the goods around that directly contribute to the control and containment and care and treatment of people who are affected by this outbreak, and also other basic social services, including other health services. So the movement of medicines, test kits, other commodities that are needed, and as well, the movement of those people that are needed to provide support to countries, including our staff from WHO, but also from other experts, from other agencies who really need to be able to get between countries, because the countries' capacities, countries are not self-sufficient. We're receiving help, requests for help with providing different types of experts in countries. So for us, this is a concern. We hope to have the opportunity to advise on when it might not be perhaps absolutely necessary to do so. But at the same time, then we are intending to negotiate, to have discussions, to have what are called humanitarian corridors availed, so that some special commodities arrangements can be made for moving those items, commodities, and people that are absolutely essential for supporting the response to and putting an end to this outbreak, and also making sure that basic and essential services are available for people.
So we have Maya on the line, I think. Can't quite catch the name. If we can put the audio through, just to ask a question, please.
Yes, thank you very much. I have a question for Dr. Moeti. How is coordination working?
Can you just tell us your name and news organization, please?
Yes, it's Maya Plants from The Shift from Brazil. It is a question for Dr. Moeti. How is coordination working among the World Health Organization offices in sub-Saharan Africa to deliver communications campaigns to inform the general public on the preventive measures to contain, mitigate the virus transmission? I hear that WhatsApp is often used to spread misinformation, disinformation among the most vulnerable.
That's a question for Dr. Moeti.
Okay. I'm sorry, I couldn't hear you clearly, but I think you were asking about the collaboration between WHO country offices on...
Right, the coordination as far as communications campaign. Because there
Perhaps
is
I'll
a
ask
lot
one
of
of my colleagues who might have
misinformation that
understood the
goes
question
around
better if they could.
social media.
Yeah, would you like to?
Yes,
Maybe
thank you very much. The collaboration between WHO offices, between countries as well as region is quite well established, and most of the guidance are widely shared to each of the country as well as the region. And there is also regular discussion almost daily between the headquarter and all the region, and concern coming from countries also brought up to the headquarter, where we have some of the services that are centralized, like global procurement, as well as also mobilizing technical aspect to reflect on some of the critical issues, like the research areas, and also some of the questions that we are asking ourselves in the field, like some of the projection models, etc. So this collaboration is well established between countries and between also region and the headquarters.
Thank you.
Very quickly, before we go, we're running out of time here on this session. We have a question about school closures. Lagos has just announced all schools will be closing from Monday. A question from Simon Ateba at Today News Africa in Washington, D.C., who asks, is this an overreaction or is this the right step at this moment, given that there were 8 cases in Nigeria at the moment?
Yes, this is a demonstration of a decision to take strong, preventive and precautionary measures once the virus has started to circulate at the community level, and limit, if you like, the regular congregation of people who then can pass the virus around. I think as WHO, we encourage strong measures early on to contain the outbreak. And then I think it very much depends on local situations and what people see as the risks then of the free movement of people, including children, interaction for hours on end among themselves, where the exchange of the virus might be facilitated when they then go home and can spread it around in families. So we are learning more and more as we analyze what has been done in different settings and in different countries to try to calibrate when might be the right moment to put in place these measures. At the moment, I think it's quite difficult to say definitively yes or no. What we understand is the earlier this is done before you have widespread, the better. And perhaps if you are in a setting where controlling once the virus has gotten out, based on the conditions, can be very difficult, it is a wise thing to do to put these measures in place earlier rather than later. This is what I would say as a comment on this.
Thank you very much. We've got a lot of questions. We will be sure to pass them on to our colleagues and friends at the WHO. I just want to thank Dr. Moeti, the Regional Director for Africa, her colleagues Dr. Yoti and Dr. Yao for joining her in Congo, Brazzaville, also in Senegal, Dr. Imbua, and in South Africa, Dr. Owen Kalua. Thanks to all of them for making themselves available for questions and for their time. Thanks to everyone for joining online. Apologies to all the many questions we couldn't get around to answering, but we will be passing them along. And I hope this was an informative session for everybody. Our thanks here from Geneva, and goodbye.